Why did you come to SSM Health at Home, and why do you stay?
Hi, I was a hospital nurse for about 22 years, and while I loved hospital nursing, I was working night shift and of course the 12 hours, and I was ready for a change, just a little bit more flexibility with my schedule and having young children. That's what prompted me to try home health care, and I absolutely have loved it. This change has been the best thing for both myself and my family. And the patient focus is amazing compared to the bedside. I love the one-on-one education, time I get with the patients. I love the fact that I get to know their family and I look at them holistically and I see everything that's affecting their care and their well-being.
What drew you to SSM Health?
The mission statement of SSM Health with a God-driven base. That was very intriguing. That was very interesting to have a God-driven workplace that intermingled actually with my personal life. So to actually come to a place and feel like it's not work and it's actually who I am and a part of who I am was a big draw for me to come to SSM.
What makes being an SSM Health at Home nurse so special?
I enjoy home health nursing. I've done it for quite a bit. I was actually working in a corporate setting and I was making policies, and every day I was in the same cubicle. So I applied here about 4 or 5 months ago, and I love it. Every day I start out with a cup of coffee from my own kitchen. We do huddle, and then I'm off. So I either call doctors in the morning or I will get to see my patients. But I like to be able to drive around every day. I've got a new view, a new office view, and I love that. I love to be able to be in the patient's home. I like to bridge the gap from the hospital because sometimes they're not getting the education. A lot of times when I did work in the hospital, we're trying to discharge the patient. And at that time, they're either medicated or they're not feeling good. So by the time you get into the home, they're more their self. They're with their dogs, they're with their family, they're with their plants, and I feel like they heal a little bit better being around that environment. So I'm in their home, so I can look at their medications that they have laying around, and then say, are you using these, or what exactly are we doing? So you get the whole picture when you're in the home, and I just love it. So the reason I got into it is because I'm pursuing my master's in nursing education. So this is helping me as well because I'm, learning the new medications as I'm working with the patients. I get hugs. My first week I got 3, so that's a bonus for me. So, and I did like the mission statement. That's kind of what brought me to SSM, and they lived up to it. And so I feel like I'm in a good place. And at the end of the day, it's on my schedule. I set up my own schedule, so then I can go home. I am seeing people in my own community, and it's kind of nice.
What difference do you see in the patient in their home versus in the hospital?
Hi, I see how patients are so much more receptive and they're very much relaxed while they're in their home. And so we're able to care for them and work with them in their home environment with their families and their caregivers.
Tell us how you onboard nurses at SSM Health at Home, and what can a nurse at SSM Health at Home expect from their leader?
So here at SSM, the onboarding process is actually it's much more structured than it has been in former places that I've worked. And so we have a dedicated education department for Health at Home, and we have a comprehensive training. It's done over the course of a month where you're in a classroom with our educators, learning our software system, learning basically the rules and regulations of home health. And then in between that time, you're assigned with a preceptor, and you are doing some classroom time, and then you're out in the field with your preceptor really learning what home health is, as well as learning the software. As far as their manager, our managers, most of them have all been clinicians in the field, and so they are very in tune to what our clinicians need. Our new staff as well as our experienced staff meet with their manager or supervisor on a weekly basis, and that they do team meetings every week. They do one-on-ones with their staff. So it really gives the supervisor or manager the opportunity to get to know the clinicians and be there to support them. Being out in the field as a home health nurse can sometimes feel a little lonely because you come from a hospital setting where you have all kinds of nurses and support right there. But the nice thing about here at SSM is that our supervisors are such an integral part of the team that our clinicians, know that they are just a phone call away. And if, they need to go out with a nurse to assist with, some new procedure or, just even a complicated patient, the supervisors are right there to help.